What's up, guys? This is Haley with Chaos Bully Kennels. Today we're going to be talking about everything that you can expect that first week with newborn puppies. This is a pretty long video, so if your dog did not have a C-section, you can go ahead and skip to minute 7. That's when I start getting into the first week with the puppies. So we did end up doing a C-section with Sky. If you guys don't know, we breed XL American Bullies. So a lot of times the female is not as large as the male. So we made the decision once we found out that she was going to be having 10 puppies when the vet did the x-ray, we went ahead and made the decision to go ahead with the C-section. It would have been anywhere from 10 to 24 hours of active pushing for her, not including the pre-labor part. So we didn't really want to put mama through that. So with C-section, they go under, they remove the puppies, the vet checks the puppies, makes sure there's no abnormalities, and they let us know if so. So we just felt that that was the safer option for the puppies and for mom. The only downside to having a C-section, other than risks of obviously going under anesthesia and, infection, things like that, which can happen with a natural birth as well. But one of the biggest downsides to a dog having a C-section is that when she is coming out of her anesthesia, she might not understand that she just had puppies. So this is what happened with Sky. She didn't understand that these were her puppies that were in her belly because she was still a little loopy from the anesthesia. So what we did was, thankfully my husband went with me to go pick her up from the C-section. So he drove, we brought the laundry basket with the heating pad, put the puppies in there. I held that on my lap, and then Sky was on the floor of the truck bed with me. I would recommend in the future, we will be bringing a crate to keep our female in. If they are crated, you just have a little bit more control. Then mom is kind of able to relax in her crate for the drive home. Thankfully, our vet is only about half an hour away, so it wasn't too bad. But she was trying to look into the laundry basket. She heard squeaking. She saw what looked like little rodents to her. So it's, I imagine, very confusing for them to wake up, see all of these little things squeaking at her. So she just didn't really know what to do with them. So we wanted to keep the puppies safe and make sure that mom was comfortable before we put the puppies on her. So when we got home, we ended up putting Sky in her crate so we could bring the puppies in, get them settled into the whelp room that we built, make sure that the heating pads and heating lamps and everything were on for the puppies so that they were coming into a nice, comfortable, warm environment. We did ask the vet to send us home with the placentas as well as the amniotic fluid. So we did put a little bit of the amniotic fluid on the puppies' backs and bottoms so that they would smell like Sky. And then we did go ahead and cut up one of the placentas and put it in with her feeding for that night. So the placenta is actually really good for them to eat. If they do go through natural labor, most dogs will eat the placenta. They break open the sac themselves, and once the puppy's born, the mother typically does all of that. So it helps the mom realize that even though she didn't go through the process, that these are her puppies. It helps her take to them a little bit easier. So while leaving Sky in her crate, we took one puppy and showed it to her rump first. That way, if she did snap or anything, it wouldn't be at the face and I'd be able to remove the puppy quickly. Thankfully, she wasn't aggressive at all. She was just kind of poking it with her nose. She didn't really know what it was. It was kind of squeaking. So she was just kind of trying to make sense of what it was and why we were putting it in her face. For this process, patience is key. You want to make sure that you aren't getting frustrated with the mom. It's easy to kind of get overwhelmed or think, oh my gosh, am I gonna have to bottle feed all of these puppies because the mom's gonna reject them? Try to just stay calm, be patient. If mom is being aggressive or if she is not knowing what to do with the puppy, just take the puppy away, put them on the heating pad. So with Sky, we ended up doing that with the same puppy. So she was smelling the same smell every time and getting more used to it each time we introduced him. Probably about every half an hour for several hours. Thankfully, we had formula and bottles on hand. I highly recommend having those things on hand in case you do need to feed the puppies, because puppies need to eat every 2 to 3 hours. So if you think about they're born at the vet with a C-section, and then the vet waits to call you until mom comes out of the anesthesia. So that typically takes about an hour. Depending on how far your vet is, your pups are going to be ready to eat pretty much by the time you get them home. So this is where having a team or somebody to help you at least, so that while you're trying to introduce the pups to mom, they can get started on bottle feeding, just so those puppies aren't getting too hungry. I do have to say this was the most stressful 12 hours of this entire week. We were getting really nervous that Sky was gonna reject her puppies, that she wasn't gonna nurse them. We kind of started getting ahead of ourselves. So we just really took it slow. She did start warming up to the puppy. I was able to latch the puppy on for about 5 seconds, and then she would kind of retreat. So then I would just take the puppy away, and then we tried it about 10 minutes later. Each time she would let the puppy nurse for a little bit longer. She finally laid down and then was calm. I put that puppy on her. Then I took a second puppy, put the second puppy on her. She seemed fine. So about 10 minutes in, then I took a third, and so on and so forth. She did have 10 puppies, so that is a pretty large litter. Thankfully, she has 10 nipples, and she's been feeding them really, really well, which is such a blessing because bottle feeding 10 puppies sounded really daunting. So we were very thankful. About 12 hours after we picked her up from C-section, she had taken in her puppies and was jumping right in, cleaning their bottoms, stimulating them for pee and poop, as well as laying down calmly and letting them nurse on her. So we are very thankful for that. So if you do have a C-section on your dog, just be prepared for that mentally, and having the supplies ready like bottles and formula, just in case she doesn't take to them right away. The next thing we're going to talk about is the puppy's weight. We ended up starting weigh-ins the following morning. So we weigh every 12 hours or twice a day. Expect a drop in weight or a plateau in weight for the first 1 to 3 days. All of our puppies dropped until day 4. So day 4 is when they started progressing, started gaining weight. On day 4, you do want to see an increase of 5 to 10% of their body weight. If it's a little bit lower, don't stress too much, especially if you have a larger litter. Mom is trying her best to keep up feeding them. As long as they are gaining and are looking strong, healthy, making noises, that's all the things that you want to look for in a good, healthy pup. So this first week, they also will be losing their umbilical cords. So whether you did a natural whelp or a C-section, the umbilical cords are going to be tied off with some sort of string or dental floss. So they will be falling off on their own. If you want, you can put iodine, just take on a Q-tip and swab their cords. I only did this for the ones that were kind of just hanging there. So I would just swab, but most of them, Mom kind of licked on it and they naturally fell off, so and dried up really well. So this wasn't really an issue for us. So the next thing we're going to be talking about is eating. So they are going to be eating every 2 to 3 hours. If you do have a larger litter, like we do, we have 10 puppies, they pretty much nurse all the time. It seems like every time I look into the whelping box, there's at least a few nursing at a time. So they kind of just take turns. Thankfully, Mom wants to stay in the whelp box with them all the time. If you do have a mom that wants a little more freedom, that wants to kind of get out more, bringing her in every 2 hours is totally fine. The puppies will be okay. They do not need to nurse all the time. Okay, pooping and peeing. So if you have an attentive mom, she will be taking care of this for you, hopefully. She will be licking the puppies and stimulating them to pee and poop because they can't pee and poop on their own right now. So hopefully your mom will be doing this for you. Again, we had a C-section, so we did have to do this the first 12 to 24 hours. She kind of got the hang of it after the 24 hours. So even after mom started stimulating the puppies, I still stimulate them 2 times a day just to check and make sure the consistency of their poop and the color is within normal range. This is just something that I chose to do to be extra cautious. That way, if they are having an abnormal poop, I can be on top of it before it becomes a problem. So some things to be watching out for and being careful of. If you have a larger dog, again, we're breeding XL American Bullies. Sky is 75 pounds before pregnancy, so she can easily step on her puppy and lay on her puppy and smash them and suffocate them. So this has been my main priority the last week. I'm actually sleeping in the whelp room with Sky and the puppies, ensuring that she's not smashing and suffocating the puppies. So the temperature range in the whelp box should be anywhere from 80 to 90 degrees. We do have a red heat light, a white heat light, as well as a large heating pad. So we are kind of alternating throughout those 3. I use the red heat light at night so that I can still see the puppies without it being so bright. I use the heating pad all the time. I have it on. It takes up about half of the whelp box so that mom can be off the heating pad and the puppies can be on the heating pad when they're not nursing. You'll know your puppies are too cold if they are whining nonstop. If they're whining and whining and whining, you know that your whelp box is too cold. You'll know that your whelp box is too hot if the puppies are moving away from the heat light or whatever heat source that you're using. Maybe the heat lamp is too close to the whelp box, you need to raise it up a little bit, or if you have your heat pad on too high. Another thing you want to keep an eye on in the whelp box is going to be the humidity. So if you are using a red heat light, we've noticed that it makes it really dry in the whelp box. So we have a humidifier that we keep on when the red light is on. So the goal for humidity is going to be between 40 and 50. You don't want it going too low or too high. Next, we're going to talk about mom. So some things that you're going to need to be checking on mom are her milk. So you're going to want to express some milk. Make sure that all the nipples are actually have milk in them. So if you just squeeze it a little bit and milk comes out, you know that you're good to go, that your puppies aren't just sucking and not getting any milk. Another thing you're going to want to check for are any hard lumps, any redness, or any heat coming off of the teeth. This can be a sign of mastitis, which is an infection of the breast or of the nipple where bacteria gets in there. They do need to be on an antibiotic for this. Another important thing you're going to want to do is keeping mom clean. So keeping her paws clean every time she goes out to use the bathroom, making sure when she comes back inside that you are wiping her paws down. We use a chlorhexidine solution because it is a puppy safe spray. So we just spray her paws down and wipe it with a towel or a paper towel every time she comes back inside. That way she's not tracking any bacteria from her paws that she might have picked up in our backyard into the whelp box. Another thing you're going to want to check is her incision if she did have a C-section, making sure there's no redness, no pus coming out. I do spray her incision twice a day at least with an iodine spray bottle. I just filled a water bottle up with water and then put a few drops of iodine in there. So I spray mom's nipples and teats, the entire underside of her belly, as well as her incision scar. I spray that 2 to 3 times a day and just make sure I'm patting it down. That way puppies are nursing on a nice clean tummy. Another thing you're going to want to check on mom is her rear end. So whether they have a natural birth or a C-section, they are going to experience bleeding for up to 9 weeks. What we've been doing is when she lays down to nurse the puppies, I just put a puppy potty pad underneath her. That way she's dripping on the potty pad, and once she's done nursing, I can just grab it and toss it instead of having to wipe down the entire whelp pad each time she's nursing. I do have chlorhexidine wipes for her rear just to make sure she's nice and clean in there, that the blood isn't all dried, because we have had several puppies try to go back there and nurse. The next thing we're going to be talking about is my daily routine with mom and the pups. So around 8 a.m. is when I let mom out to potty. While mom is out in the backyard getting some fresh air, getting a break from the puppies, that's when I go ahead and run in the house, prep her breakfast. Once mom comes inside, I go ahead and feed her. She right now does want to only eat in the whelp box with the puppies. She doesn't leave them for more than probably about 10 minutes on her own. So once mom is fed, she typically lays down and continues nursing them. Our puppies pretty much nurse as long as mom is in the whelp box. There's always a couple puppies on her, or she's cleaning them or cleaning the box. So she's been a really great mom. We're super thankful for that. So once mom has had her breakfast, I go ahead and medicate her. So she is on pain meds and antibiotic after the C-section. We are also giving her fenugreek, which helps with lactation. With 10 puppies, we want to make sure we're giving her as much as she can so that she can keep up with her supply with all of the puppies that she's feeding. We also give her a postnatal vitamin. We use the Oxy Mama, so she's getting all the nutrition she needs from that as well. Once mom gets her food and her medicine, I go ahead and take the puppies that aren't currently nursing one at a time, and I do their weight check. So I do weight checks at 8 a.m. and 8 p.m. And then after we do weights, I do go ahead and stimulate the puppies to pee and poop so that I can assess their poop to make sure that it all looks normal. And then around midday, Sky is getting lunch. So you want to make sure you're giving your mom as much food as she will eat, basically. Since she is nursing, she has to keep her calories up. Right now, Sky is getting breakfast, lunch, and dinner. And I typically let her out to potty morning, afternoon, and night. Obviously, in between, if she gets up and walks to the door, I know she has to go to the bathroom, but this kind of gives her a chance to have some time away from the puppies and enjoy the backyard, enjoy some fresh air while I'm prepping her food. She gets to have a little bit of rest from her puppies. That is pretty much it, guys. If you have stuck with me for this long, thank you so much for watching. Don't forget to check out the puppies on our website, chaosbullies.com, and we'll see you next time.